Yeah, great to have you all aboard. I can't see everyone at one time, but I know there's quite a few people that I've already met in the physical. Much love to you guys. Thank you for your interest. To all those that I haven't met in the physical, fantastic to have you aboard. I hope I can keep you interested, entertained, and perhaps enlightened somewhat over the next 35 to 40 minutes. Back to you, Naomi Jansson.
Thank you. So in our lead-up sessions, we have been delving quite deeply into the process of what is termed a root treatment. So we covered that, approximately 80% of our treatment outcome can be placed in the hands of that root treatment process. And so we've been covering the process piece by piece, what constitutes that root treatment, what goes into that, so that is, as you sort of term it, the powerhouse of your treatment, how to make that as effective as possible. So we've covered the theoretical basis of the root treatment, and then we've talked in depth about needling and the approaches to needling and where that comes from a classical perspective as well. And the natural lead into the next topic of what occurs during a root treatment is the pulse taking. So this is a massive undertaking in and of itself, requiring many years of study and also practice to achieve really reliable data collection as this component of a practitioner's skill set. But would you mind talking with us this morning about the root, in context of the root treatment, about pulse taking? So my first question is, when in the root treatment is the pulse utilised?
Can I just elaborate a moment just before answering your very good question, Naomi? Just my experience in pulse taking, so that people understand the perspective that from which I'm coming. So for the first 13 years of my acupuncture career, I knew basically nothing about taking the pulse. In fact, I didn't take the pulse at all. I still got okay results. I probably mainly treated musculoskeletal issues, and I treated just reading or talking to the patients about their symptoms, and I used that as a guideline. It wasn't until I went to Masakazu Ikeda Sensei's clinic in January 1996, where the first thing he got me to do was actually take the pulse of a patient whilst he was treating, that I actually realized the importance of the pulse, of taking the pulse, and understanding the value of integrating that into my treatment protocol. It was an incredibly challenging scenario, in as much I've been practicing 13 years. Whilst I didn't believe that I was brilliant, I could not believe I'd missed such an important part of the diagnostic process in traditional East Asian medicine. So from that perspective, Ikeda Sensei taught me immediately, without saying a word, how important it was to take the pulse. And for the first time in my career, as a result of taking the pulse whilst Ikeda Sensei was performing the root treatment, I understood the spontaneous response of human-to-human medicine. Of actually taking the pulse to ascertain the efficacy of the treatment and the direction of the treatment in that moment. That was a massive breakthrough, but also presented a huge challenge in understanding and then being able to apply in clinic all the principles of the pulse, taking the pulse and distinguishing the value of the pulse, especially during the root treatment. I would say that not the first thing I'll do. It depends. If we're treating a person that we've treated before, we're familiar with that person, then the protocol's a little different. But certainly amongst the very first things, apart from saying good morning, good evening, how are you, whilst I'm asking those questions of the patient, I'm also taking their pulse. I think one of the important things to understand is that the integration of the diagnosis with the treatment and the flow, which we'll get into in a couple of weeks' time, the actual flow of the treatment. But I take the pulse with the patient laying down, and I am ready to apply treatment, and they are ready to receive treatment. So in a sense that the patient's already lying down, taking the pulse is actually part of the treatment. Not only do we get a deeper insight into the energetic movement or flow that's occurring for the patient, we also confirm to the patient that we are fully focused on them at that time. And please, I have no doubt there is an incredible amount of potency involved in human-to-human medicine. We're losing that a little bit as we go more into the 21st century, and classical or traditional acupuncture was very much about the human-to-human connection. And we confirm that when we take the pulse, and we also confirm that obviously when we're delivering the treatment and with our presence of mind with the patients.
Thank you. Very eloquently put a big context there for us to understand what's coming next. So thank you very much for taking the time to explain that for, you know, practitioners. I just want to say as well that we are building into, not next week, but coming up, Alan will be demonstrating the process of a root treatment. So for anyone who's sitting there thinking, well, what does that actually look like for a patient treatment? If you come to that particular session, you'll actually see how that process looks in the context of what Alan's talking about. So perhaps we're circling back then to exactly when in the process is the pulse utilised in a root treatment?
Good question. Well, as I've just said, it's one of the initial diagnostic focuses, without doubt. I like to understand the condition of the patient, the symptoms. I will ask them, how's their sleep been? Are they going to the toilet regularly? All of the, do they suffer, have they got pain anywhere in the body? This information I'm asking as I'm taking the pulse, and then we'll go into a quiet space where I just will focus on the balance of the pulse. There's the balance between the left and the right, and the balance between the three positions on the left and the right wrists, and then the overall quality of the pulse. And then we can go a little deeper in understanding the quality of the pulse in each of the individual positions. In my experience, the more information that we can ascertain through taking the patient's pulse, from my clinical experience, the more efficient and the more effective the treatment is. And so during the course of the root treatment, I will refer back to the radial pulse to get information on how my treatment is actually affecting the patient. I find this is it's invaluable to be able to follow the movement of the chi through the taking of the pulse, and understanding that the pulse responds to treatment immediately. And that gives us that spontaneous feedback that whether we are on track or not. So the root treatment is a two-phase situation. The first one where we're tonifying the affected yin meridian, or the deficient yin meridian, if you like, primarily. And the secondarily, we're balancing the yang meridians. But we've discussed that before. But basically, taking the pulse will give me an information about how I've been able to support the deficient yin meridian organ complex, and how that support of building the yin energy or the contracting energy, how that's affected any excessive amount of yang energy that might be prevalent. For instance, a person with headaches, for instance, obviously the yang energy is prevalent in the head. Person with chest problems, the yang energy is present in the chest. So via the pulse, I'm able to ascertain whether I'm walking down the right street or whether I need to go around and around and come back again and rephrase my approach to this particular patient. So in a short answer to your question, Naomi, I'm taking the pulse several times. In most cases, sometimes not so complicated, but many times I'll take the pulse several times during the course of the root treatment and then confirm an outcome at the end of the root treatment that says to me that I've been able to balance the pulses according to the patient's constitution, and then I'm able then to consolidate the treatment by utilising either the front mood points, abdominal points, back shu points, or working on branch treatment if we're looking at articular problems. So in a nutshell, I use the pulse a lot. And the benefit of that, apart from being able to have more of an insight and understanding of what I'm doing, is that every time I take the pulse, I'm developing my awareness, my understanding, and my experience. So every time we take the pulse, we improve, because it's the sensitivity in our fingertips and the connection between our awareness of what's happening at our fingertips and our cognition of that awareness is a huge driver in growing exponentially our efficacy as a practitioner of traditional East Asian medicine.
Thank you so much. And could you also contextualize for us whereabouts in the classics perhaps the pulse has been discussed and how that's utilised for a context?
It's mentioned in many of the classics on many occasions, but the first typically in the Nanjing or Nankyo, this probably relates very much to the importance of pulse taking. The reason that we take the pulse in the radial position, there are other areas that take the pulse, of course. We can take the pulse on the throat and the stomach 9 area, take the pulse stomach 42, kidney 3, liver 3, all sorts of places. We can take the pulse in the abdomen even. But because the radial pulse is present on the tai yin or the lung meridian, which is qi-based primarily, in the sense that it deals with the qi and the dissemination of qi in the body, this is where we will read a response very, very quickly. And so the Nanjing first difficulty, that states actually the importance of being able to read the pulse. There's also, Ikeda Sensei has just, in the last 12 months, he has published Maijing, the clinical application of the Pulse Classics, which is a 2-volume set of incredibly intimate and intricate information about understanding how to use the pulse. So I would refer to the Lingshu, the Nanjing Chapter 1 and the Maijing Pulse Classics as being the primary source of information regarding the pulse, so particularly the Maijing or the Pulse Classic. If you go over to the World Acupuncture website, go to the shop, you'll see the book there. It's quite extraordinary and very informative. Did I answer the question appropriately, Naomi?
Yes, you did.
Okay.
Thank you. So we've already talked a little bit about my next sort of 2 questions, but I'm just wondering if there's anything else that you wanted to cover or clarify. So just discussing about that dynamic nature of information that's being gathered with the pulse taking, and what specifically, you have already covered this, but I'm just wondering if there's any other layers or angles that you want to cover of what information, the dynamics of the information that you're collecting. from the patient with taking the pulse, without going too much into the mechanics of taking the pulse, which is a whole other session. Is there anything else that you, just where the dynamic nature of it?
Taking the pulse is it's an art form. It's something to be learned. Actually, I'll just make a quote from Yasunori Noine sensei, one of Ikeda sensei's outstanding desis, who's now in practice by himself and was the main translator for the Meijing clinical applications of the Pulse Classic for Ikeda sensei. And then I'll roll on a little bit, but I think this is beautiful. And I would hope that everyone who is who is watching and listening to this understands the importance. This is the single most important statement that you can absorb. And it's so applicable in the 21st century, where we can drive in and get takeaway, McDonald's, et cetera, et cetera. You know, everything's about quick, fast. In the beginning, it may be difficult to understand what the Meijing or the Pulse Classic really wishes to convey. It will be revealed as if the mist clears. So it's not instant enlightenment. This is a gradual process of opening the eyes, the ears, the heart, and the mind to the possibilities. And this book, the Meijing, is absolutely, it's magical in the way it does that. There's the insights that we gather as a result of studying this particular classic, quite dynamic and quite important. It's important, and again, this is the same thing with traditional medicine and with the walk of the Kumano Kodo. This is where it really drove home to me that this medicine is about the journey. We don't get to the destination by getting a degree in 4 years or being in practice for 12 months. This is a destination. I even doubt that I'm ever going to reach my destination with traditional acupuncture, but the important thing is to understand that it's a journey and not to give up when we get to the difficult parts, because some of this journey, it's very difficult to understand the concepts and just what the ancients were trying to convey. This is where we're incredibly fortunate to have someone of the caliber of Masakazu Ikeda sensei to assist us in understanding how to apply this information in clinic. That is the key to Ikeda sensei's work. Anyone that's tried to read the classics without a degree of clarification will understand what I mean. We can spend a month contemplating on one paragraph. It's incredibly intricate and written in a way that a mystifying way. It's intentionally written that way to make it difficult to read and difficult to understand. We have to work. The ancients didn't want to give it to us on a plate. They wanted to make us work. And fortunately, Ikeda sensei's made it easier in the sense that he's made the information from the classics relevant to clinical practice, which is just vital. But as Yas sensei says, but to keep going, even at a very slow speed, even if the road is not flat, because we are part of the river's flow, which has been in motion since ancient times. It will push us forward gently unless we intentionally stop ourselves. So what Yas sensei is alluding to is we chip away at the study of the classics, then the information seeps into us a bit like the sap in a tree. It actually spreads through like blood flow. It's incredibly valuable. As far as taking the pulse, any tips I give is take your own pulse. Take your own pulse when you wake up. Take your own pulse lunchtime, and take your own pulse before retiring of an evening. Take your pulse when you have a drink. Take your pulse after exercise, before exercise. Take your family's pulse. And most importantly, if you're in practice, take your patient's pulse. And you may not understand it. That's not the concern. Understanding immediately, unless you're particularly gifted or of genius level, both tactilely and intellectually, understanding the pulse immediately is a very, very high goal. And I urge, again, as Yas Sensei says, allow the mist to lift. But for that to happen, you need to study. And we are so fortunate that we have books of the caliber of those that have been translated from Ikuta Sensei's work available. Incredible. It's, yeah, I can't exaggerate it too much. For me, it's my bread and butter. I mean, I get nourished. I eat these books very slowly, very steadily. Metaphorically speaking, I don't actually digest the pages, of course. Naomi, if I missed the point there.
No, I think that's wonderful. Was there any other tips or guidance that you perhaps could offer for novices that are looking to get into sort of acid, like using pulse taking as part of their practice? Anything else?
Yeah, absolutely. I was talking with Maria yesterday, and she was saying that there are some practitioners she's been working with that that don't use the pulse in practice. So I guess someone's been in practice for 1 year, 2 years, 5 years, 10 years, and never used the pulse. It's going to be a real challenge to integrate that into your treatment program, and you'll need some guidelines. Surely they're available. There's a lot of information available on the World Acupuncture website in regards to that. But essentially speaking, we are taking the pulse with the pads of the fingers. I won't go into it too deeply. We're using the pads, not the tips, the pads. And when we initially take the pulse, we are resting our fingers lightly on the radial artery. Do we feel the pulse immediately? Or do we have to apply more pressure to feel the pulse? This is the first thing. How much? So the first thing we're looking at, I guess, is the quantity. And I'm still working on quantities, but that was the area, and that's the way I started to read the pulse. Now I'm really developing my understanding and my feeling and appreciation for the quality of the pulse. Is it a slippery pulse? Is it a sunken pulse? Is it a choppy pulse? Again, I'm not saying this is a simple process. What I am saying is the more that we can integrate our understanding of the qi and blood flow of the patient through taking the pulse, the more information we have to make a considered and comprehensive diagnosis of the patient's condition. We can move that into and apply that to the symptoms of the patient. And understanding. And the interesting thing is we take the patient's pulse, the patient is aware that our focus is 100% on them. It makes a huge difference. We can talk a lot to the patient. I don't, but you can. It's not something I do. But they know when I have my fingers on their wrist and I'm listening and I'm doing the treatment and going back to listen, they know I'm 100% with them. That, for mine, is an incredibly valuable aspect of taking the pulse, regardless of the information we're able to glean from it. The security or the confirmation for the patient is huge. It's massive.
Wonderful. And just leading on from that, I'm just wondering if you've got any clinical examples.
I have a very good one. It was a clinical example. My God, to isolate. I did a treatment on the weekend, and it was a very challenging treatment. I have been treating this patient for some time, and I have had, they have an issue. Basically, they have a condition that causes inflammation of the veins in the body. We were very suspicious for a while that it could have been cancer. Fortunately, it's not. But basically, this condition where it's affected their veins has caused inflammation in the heart. So the heart pulse, it was just proving each and every treatment it was like a pitched battle almost. It was like, come on. I tried every trick in the book that I knew. I used the 5-point pericardium meridian, the 5-point of the spleen meridian, tonified kidney too, and we'll explain the logic behind that, or we have to some degree before, but just to accept I'm trying all that I knew to quell this very strong heart pulse. Eventually, I kind of got led down the garden path, and I eventually, this is where intuition comes into it. This is 37 years. I got a little bell went pericardium 1, pericardium 1. So I applied pericardium 1 very superficially, 1-2 mil max, and then went back to check the pulse. And the patient's pulse, for the first time in several treatments, responded spontaneously to my plea to quieten down. And so I now know that to operate more effectively with this patient until such time as we're able to bring everything into a more balanced state, that pericardium 1 will help me and help him, most importantly, to regulate the heart pulse and the heart position. Having excessive amount of heat in the heart over an extended period of time is not a good scenario at all. So I was, it was a situation that it really stood out to me as being showed the true value of being able to take the pulse and work with the pulse during the course. And the pericardium 1, whilst it's not a command point, it was part of the root treatment and will form part of my root treatment until such time as we've been able to regulate the heart pulse by tonifying the affected yin meridian. So that brought a smile to my face. And again, nothing means anything unless the patient is improved and feels improvement in their condition as a result of our treatment. But certainly taking the pulse is very applicable, a great way of understanding where we're moving in the treatment. It's like to develop that connection between the fingertips. It's much like when we're needling. It's much like when we're doing HARA or abdominal diagnosis, or we're palpating the meridians, or we're feeling the chest for heat. The connection between the fingertips and the hands and the mind and the heart, this is the intuitive process. So the more experience we have in the palpation of the patient, by taking the pulse, the treatment with the needling, and understanding the implication through our tactile sensitivities, it's vital to mine in developing a comprehensive skill base to apply traditional East Asian medicine in the most effective manner.
Thank you so much. That was really wonderful. Really great entry point into something that's so complex and so essential and valuable throughout an acupuncturist journey and herbalist journey. And just wondering if you had anything else that you wanted to cover before we open it up for questions.
Again, I think I'd just like to reinforce Yas Sensei's incredibly wise words. This initially, it can be overwhelming. I mean, I'm just talking about the pulse, but let alone that, the study of traditional medicine is a huge undertaking. But to understand that it's a journey and we just chip away at it. And I've had to move a lot of barriers myself, being the type of person I am. I wanted it yesterday. And it was not the case. And it's taken time for me to understand that it is indeed a journey, and to be patient with myself and allow myself to learn and make mistakes, and not to be discouraged when I do make the mistakes, but to do my best to learn from making the mistakes and not to celebrate the wins, but to acknowledge the wins. And again, that's been an aspect of my personality. I'm more likely to take on board the mistakes than I am to celebrate the victories. And to me, to moderate that aspect of my being. And in that way, learning and studying traditional East Asian medicine has had I think, a very mollifying or moderating effect on my personality and my way of being. I would hope so anyway, because I was an extreme character for many, many years.
I can confirm that your personality has changed over the last 40 years, according to this practice.
Especially the last 3-4 years, it's been a beautiful evolution for me to experience. Again, it's a matter of understanding that it's a process, and the destination is down the track, and just to work away and chip away. It's been a really rewarding and beautiful journey.
Thank you. And Maria, would you like to take over from here, just managing questions that might be coming in?
Yes. If anyone wants to make a question, please write it on the chat, and we will read it to Alan so he can answer your questions. Preferably related to the topic that we exposed today, that would be the best. Well, I can answer, Ailey. Yes, there are recorded videos of the last webinars. Maybe you can contact me. I'll just give here my email. Also, if anyone wants to contact me, something related with the website, you can contact me. I'll leave my just here. So. Okay, Alan, you have here Ollie. She's making a question. What is the difference between 3 fingers recording pulse? Not sure I understand the question. Do you? Difference between 3 fingers?
I'll give it a go. So, essentially speaking, we have the triple warmer, or the 3 heater, or the Sanjiao. However you know that entity. So we're looking at the conditions of the Zhang and the Fu via the meridians, the related meridians. Excuse me. So on the left wrist, on the distal pulse, we're looking heart and small intestine. The small intestine being the yang pulse is the most superficial, heart being the yin connection of the fire element, that's the deepest. That's the yin-yang connection on the distal position there. In this bar position, we have the liver gallbladder, the same setup as heart, small intestine, the related yang meridian or Fu being the yin being the liver and the yang being the gallbladder. And then in the proximal position, we have the kidney and bladder pulses. Again, we read the pulse from the radial artery to give us information of the state of the meridian and the related Zhang Fu. On the right wrist, we have in the distal position the lung and large intestine meridian. The lung being the yin partner of that particular coupling is the deeper of the pulses, the large intestine being the more superficial. In the bar pulse, we have the spleen and stomach pulses. Again, the deeper pulse being the yin meridian being the spleen, superficial meridian being the stomach. And then we have the proximal pulse on the right wrist. This is goes by any number of names, but essentially speaking, we have the pericardium is the deeper pulse, and we have the pericardium and the triple warmer is the superficial pulse. This is an interesting position. The right side and the proximal position, it represents the Ming Men. So the kidney yang, which is kind of a combination of the pericardium, the triple warmer, and the kidney yang all work together. So there are all different conclusions to draw from the state of the pulse. If we can't feel the pulse at all, then we either have, there are a number of different conditions it can allude to. I won't go deeply into that at the moment. It's probably not appropriate. But,
thank you.
Yes, I would suggest.
Thank you, Alan.
Yes. Okay.
We have here another question. We have actually a lot of questions here, but so we start with Sylvia. She's asking, when we don't feel the pulse in the person and we press a bit harder and still nothing, how can we approach this?
Oh, Sylvia, very good question. Probably, well, the way I work, which is the way I've learnt from Mikado sensei and Edward Obeidi sensei, is to utilize the abdominal points. So we might very lightly insert the conception vessel 12, conception vessel 4 and stomach 25 and leave the patient to rest for 5 minutes or so. There are a number of different ways of understanding just what is behind the lack of pulse. It can be sunken, can be lack of Jin-Yang or fluids, and also be lack of Yang-Qi. The treatment for those conditions differs demonstratively, so we need to really understand whether it is the deficiency of Jin-Yang or a deficiency of Yang-Qi or a deficiency of both. As I say, we can just use that light abdominal needling and leave the patient covered for 5 minutes or so and come back and see whether we have a pulse that we can discern any differentiation on. It's obviously not a good state for the patient, for it to be very, very difficult to take the pulse. There are other techniques that we can use. We can use a very gentle dispersive needling, working out from across the epigastrum from right to left, which encourages the liver to divest itself of the load. That will help us again, and it'll put a little bit more Jin-Yang, a little bit more Qi and blood out in the system and help us to discern where the specific deficiencies are. Obviously, there's, in a sense, there's a yin excess in that the pulse is really, really, really deep, or there's a yin and yang excess where the pulse is really deep and there is very little Yang-Qi as well. The symptomology of those patients will differ a little bit, and that's a whole new ballgame to go into that in great depth. I would suggest very, very light needling of CV12, CV4 and stomach 25 to help clarify the situation with the pulse. If after that you can't feel the pulse, then it's very, very important to approach the treatment of this patient with caution and extremely gently, because the last thing we want to do with someone who is really debilitated and very blood deficient is demand a very strong response from them, because all that will do will be, we're just basically mugging them from a Qi perspective, and they'll get off the table feeling like they've had a rather large steamroller ride over them. Oh my God, I have no energy, I cannot move. That's usually a really good indication we've overtreated or treated incorrectly for that particular patient. We want the patient getting up off the table, feeling improvement in their condition every time. Hope that works for you, Sylvia.
Thank you, Alan. Actually, the next question from Lucas was about utilizing these 4 points in the abdomen, and if you could explain a little bit about it. So you explained you could use it for this type of situation. Is there any other situation you would use the abdominal points before taking the pulse or the treatment?
Yeah, if a patient should arrive and the pulse is irregular, they rushed, or the patient's under undue stress at that particular juncture of time, certainly I know many practitioners who, as a standard procedure, they will insert these 4 points in the patient's abdomen at the very, very initial part of the treatment, just to give the patient the ability just to wind down a little bit and just to come back into their body, if you like, especially if they've been rushing or the pulse is particularly rapid. And it helps us to clarify the situation. I must say again, this is not needling deeply in the abdomen. We're talking about inserting the needle 1 mil, 2 mil deep. Please, when you're treating the abdomen, try Light needling.
Thank you. So we have here a question from Yuri, and he is asking, how can we distinguish if the pathology, by taking the pulse, if the pathology is in the meridian or is in the organ?
Thank you. Okay, Yuri. Essentially speaking, if the pathogen is in the meridian, there will either be numbness, pain, coldness, heat, rash. That will appear in the meridian. So there will be an imbalance in the meridian, especially articular, tennis elbow, frozen shoulder. With that imbalance in the meridian, there would in almost all cases be a relative imbalance in the associated Zhang and Fu. So we treat as a whole the meridians and the organ in our fundamental approach to the root treatment, in that the meridians and the organs are part of the one complex. They're not separate. But we treat slightly differently when the symptomology, for the sciatica, for instance, in most cases, in a lot of cases, we'd understand that as being a liver deficiency syndrome. We would treat the liver deficiency because it's from that imbalance in the Zhang and the Fu that the meridian pathology emanates. For instance, let's just look at lower back problem. The lower back problem, let's just say the pathology is occurring in the bladder meridian in the lower back. From that perspective, we have a fundamental, in most cases, not in every case, but let's just take a hypothetical example that the imbalance is fundamentally from a kidney deficiency, yin deficiency syndrome. As a result of the kidney deficiency, yin deficiency syndrome, there's what we call deficient heat. We call it deficient heat because it emanates from a deficiency of yin. It's not that the heat itself is deficient. It comes from a deficient source. So we're relating back to where it came from. So when we call it deficient heat, that's what we're referring to. So the deficient heat, it will go somewhere. Now, the first place that will tend to go, depending on the constitution of the patient, but the first place it will tend to go will be to the associated meridian of its Fu partner. So this is the bladder meridian. So the heat goes into the bladder meridian, causing the pathology in the lower back. So we treat this problem by tonifying the kidney yin. And in tonifying the kidney yin, we're stemming the source of the imbalance. And then after that, if we need to, we moderate and regulate the circulation of the yang qi in the bladder meridian. And we could say a similar situation for articular issues, that the fundamental imbalance is in the Zhang and Fu, but the symptomology is being presented in the meridian. And the same could be referred to when we're looking at arthritis as well, and particularly rheumatoid arthritis, which is where the issue is being presented like throughout the body, but the fundamental imbalance is in the Zhang Fu. So I hope I've answered your question, Yuri. We're referring back always to that fundamental imbalance with the understanding that the meridian and the Zhang, or the Fu, or the Zhang and the Fu, they're intricately related to each other. And the more we understand of the physiology and the interaction between the Zhang and the Fu, and the pathophysiology of where things go wrong and how things are more inclined to go wrong for mine, then the more specific we can be in our root treatment, the more specific we can be in our root treatment. From my experience, the more potent and the stronger the effect is of our overall treatment, and the benefit for the patient patient benefits accordingly.
Thank you, Alan. We have here another question. We have from Kayleen. She's asking if do you check the pulse? So you give the root treatment, then you give the front front mu or back shu points. And then after that, do you go and check the pulse again? Do you do that in your practice?
It depends on the patient's condition and what they're presenting for. More often than not, no. That's it. But there are situations where I will come back in and double check. But my main, if you like, my guideline at the end of the treatment is very much about how the patient feels at that time. Are you feeling better? Yeah, I do. My headache's better, or my neck and shoulders aren't as tight, or the ringing in my ears is a little bit better, or I don't feel the need to cough all the time. Whatever the symptomology that the patient presented with, they're able to express some degree of relief from the intensity of the symptomology. That's the main indication I use at the end of the treatment to confirm the efficacy. But there are exceptions. Nothing is cast in concrete for sure, and that much I've learned in my practice. But I use more the condition of the patient and the feedback from the patient at the end of the treatment. But I say again, there are exceptions.
Thank you, Alan. I have here a question. I think it's about the positions. Maybe you can understand it better than me. Can we differentiate the right and left side of the heart and lung from the pulse?
The right and left side of the lung and the heart.
From the, yeah, in the pulse.
I don't. I'm not saying that people don't. I'm not saying there aren't people out there who have more expertise than I in the taking of the pulse, but no, I don't differentiate between the right and the left side of the lung. Some practitioners that will take the pulse on either side of the radial artery, so the medial aspect and the lateral aspect of the artery to get more information. I don't have that level of expertise at this particular point of time.
So what is a healthy or balanced pulse? What are we looking for?
Because we're referring to the condition in which the patient feels the best. In other words, their constitution. And for some patients, and it's a very good question, Sylvia, for some patients, the liver deficiency pulse is the pulse that we want them to be rested. They feel best when they have a liver deficient pulse. For others, spleen deficient. For others, lung deficient, kidney deficient. Some people feel better with a liver excess pulse. So it's really relevant to the individual patient and very much so to the constitution. So we're not looking to correct the pulse to make it a flatline pulse where everything is perfectly balanced with everything else. This is not real. This is not a reality. This is not the human condition. The human condition is that patients are constitutionally imbalanced. This is something that we are as humans. The evidence is staring you in the face. Here I am. Yeah. So how am I constitutionally imbalanced? There's nothing up there. Why is there nothing up there? Because constitutionally, I became a kidney deficiency, and kidney deficiency to the level that I managed to achieve, enough heat was going up into my head to cause the growth on my head, my little trees and my little plants, my byproduct of the blood to run away. And the reason it did that, it's a life-saving measure in as much as that the hair on the head is an insulator. So by the hair on my head running away, jumping out, meant that my head could cool off easier, which meant the potential for me to enjoy a cerebrovascular accident or a stroke was minimized to some degree. So constitutionally, that's what occurred for me. And for most people who've lost their hair, it will infer there's a level of kidney deficiency. And we have all sorts of deficiencies where people really feel comfortable. So That's a very, very difficult question to answer. Suffice to say, after we treated a patient sometime, we will start to understand if we're taking the pulses regularly, then we start to understand, oh, the patient feels really good when their pulse feels like this. Again, this is part of the learning paradigm and the brilliance and the genius of actually taking the pulse regularly, because we get an insight, literally an insight into what's happening for the patient. And that insight depends on our sensitivity of our fingertips. As far as pulse taking goes, playing guitar can be a bit detrimental in the sensitivity, but we want to look after our fingertips. We want the sensitivity to be there, and we want, well, as I want to understand the paradigms behind that in this grey matter here, and that requires study and it requires practice.
I think we're reaching the time. Maybe just answer very, very quickly to this one, because I think it's important for people to maybe know. There's Eugenie is asking, what is the difference from Chinese traditions of pulse taking? So is there a difference in what you're teaching from the Chinese traditions, or what you're teaching comes from the Chinese? Just making that clear, I think, would be. Well,
it depends on who's teaching it. You know, as many schools of acupuncture there are on planet Earth, there are an incredible variety of ways of taking the pulse. But to reassure you that this pulse taking technique, or this way of reading the pulse, is from the Chinese classics. It's not Japanese. This is a massive, massive misinterpretation of what is going on. Traditional Japanese acupuncture or traditional Japanese medicine emanates from the Chinese classics, 100%. Theoretically, 100% based on the traditional Chinese classical texts, the Nanjing, the Suwen, the Lingshu, the Shanhanlun, etc.
Thank you, Alan. Thank you. I don't know if you you or Naomi want to finish and say something.
Well, I'll just say a little bit. I'm loving doing the webinars. I find it very intriguing. I don't know, there must be some part of my, maybe it's the original lung deficiency, where I just love to talk about what I am passionate about. And I'm incredibly passionate about this medicine. I've just seen so much now over 37 years, and I know that people just look back and say, what the hell are these doing? We are practicing human to human medicine. And I'm absolutely convinced that, especially in the next few years, the demand for human to human medicine is going to go through the roof. Because for sure, what is going on planet Earth at the moment is really moving the foundations for all of us. No question about it. And thank you so much for your questions. Thank you so much for your attention. We'll be back again next week. Maria will fill you in on that.
No problems. I probably just mentioned that in our series that we're working through, that next week we'll be covering HARA diagnosis, so the abdominal diagnosis as part of the root treatment.
Thank you. All of you that have been here, the previous seminars, have seen me sharing a little bit about the resources you can get from World Acupuncture. And just would like to share with you the resources you can get from worldacupuncture.com. So you can have the books, you can have all the books that have been, not all, but some of the books translated into English from Masakasa Ikeda Sensei. You can go to the shop. And also we have the video seminar with CPD points from Masakasa Ikeda Sensei. And also in the website, it's an online learning platform with more than 200 videos. It's around 15 years library with a lot of teams being exposed, like diagnosis, syndrome patterns, and skills. So you can have a look in the free videos. And also you can have tutoring directly with Jansson Sensei. if you would like that. You can contact him directly. So you can contact Ellen at worldacupuncture.com, or you contact me, Maria, at worldacupuncture.com if you have any questions regarding the website and the next webinars. Thank you for being with us. And I hope to see you next week with Haro diagnosis. Bye-bye, everyone.